problem, and therefore I'm going to wrap this up. I hope that I've made the case that COVID-19 is a human movement problem. And I also hope I've made the case that movement-based healthcare must be a priority during this time of COVID-19 as well as afterwards. For your attention. Thank you once again to the organizers. And I truly, truly hope that this lit a fire within you to be empowered, inspired, to really want to be leaders in healthcare, not just rehab leaders, but overall healthcare leaders. And with that, I wish you all the very best, and I thank you very much.
Thank you, Dr. Ross. Thank you for very inspiring speech and then a very different perspective into the uh, COVID issues and how the movement problem helps in how the current healthcare outcome model works. We had a very different perspective and so can we have participants if you have any questions you can put it forward so we can take up one or couple of questions.
Yes, sure. Happy to answer
Hello,
questions.
am I audible? Uh, so I can't. Sir, I have a question. Can I put forward it? I recently have come across an article stating this coronavirus has an, a more affinity towards ACE receptors. And how does that?
Yes, I'm glad you asked that question, and thankfully it is a question that I can answer based on the reading I've done and also the article that the articles that I myself have published. So SARS-CoV-2 uses this protein or enzyme that is located at the plasma membrane of various cells, and that protein is ACE2. Um, it can only get into cells via the ACE2 receptor. That has been confirmed that it needs the ACE2 receptor to infect cells. And related to that is what happens as a result of it? What happens as a consequence? When it goes in through the ACE2 receptor and cell where it starts using the cell's machinery to act as a sort of a slave, some gene expression changes happen. And one of those gene expression changes is a reduction in ACE2 at the plasma membrane. When ACE2 reduces at the plasma membrane, what ends up happening is a signaling molecule known as des-arg9 bradykinin, it starts accumulating in the extracellular environment. Des-arg9 bradykinin is a pro-inflammatory molecule. It goes and binds to the bradykinin 1 receptor and it triggers inflammation. So what we think is happening is that that process is a key component of the pathophysiology of COVID-19. And therefore, if we can block the effect of des-arg9 bradykinin, it is likely to produce better outcomes in patients with the disease. In fact, that is the angle that is being now targeted by various clinical studies. Can I answer questions from the chat? Okay. A couple of you have asked this question about.
Yes, sir. Sir, thank you
Sure.
for informative information, sir, for the session.
Pleasure. So a couple of you have asked the question, is there a chance to get infected again? There is a chance to get infected again. What we do not know is how long does immunity last after a person has got infected. There is also this other angle, which is the virus always the same? Is it always exactly the same? Or are there some different forms of SARS-CoV-2 virus? The answer to that question is that there are different forms of the SARS-CoV-2 virus. You can do sequencing of its RNA genome, and you can tell if it's the same thing or if it's different things. And what they have found is that there are patients who've got infected by two different, slightly different forms of the SARS-CoV-2 virus. RNA viruses like the SARS-CoV-2 virus, they do have a tendency to undergo changes, mutations, and that is a concern too in terms of developing immunity. But let me give you some good news. The body tends to have a sort of ability to learn how to fight a set of different viruses. And if you have been infected by a coronavirus, there is a chance that you might get immunity to other coronaviruses too. In fact, this is the reasoning that has been proposed for why young children are not getting badly affected, because young children are affected a lot by colds, and they get other respiratory infections caused by coronaviruses. And because they've been exposed to some other type of milder coronavirus, when they get infected by SARS-CoV-2, they're probably not developing as severe symptoms as others. So that's the good news, that yes, there is some cross protection against different types of coronaviruses. But the point that I would like to mention here is, just because you've got infected doesn't mean you can say, I'm now immune. I can just, not wear a mask. I don't have to protect myself. I can just be careless and move however I want. That is a risk. That is a problem. That is foolish. It is important to continue to follow all the precautions till the virus actually weakens and eventually goes away. It will happen just as it has happened with the original SARS outbreak. We humans need to use our brains because the SARS-CoV-2 virus does not have a brain. In fact, it's just, dead information till it finds a host cell. Let's go to a question that is about future pregnancies. That is a question that's outside of my scope of knowledge, and I'm going to defer on that question. Unfortunately, I cannot answer it. I don't know enough to talk about it. The next question is, human movement is responsible for the spread, and physiotherapists should be at the forefront. Sorry, I was answering a question. Is that okay?
Yes, sir.
Okay,
So we'll wind up with this question, sir. So the time
certainly. Okay.
constraints.
Okay, perfect. I'll wind up with that question. It's about, how can physical therapists be involved? Well, in order for us to be able to make ourselves heard, we have to first educate ourselves. So you have to learn a little bit about the virus, how it spreads, what is the scope of physical therapy practice, what are other professionals doing for this virus. And one of the main things that we can do is to serve as health educators. We should not add to the noise that we are seeing around the world. There's a lot of noise, there's a lot of nonsense that's coming out of people's mouths, whether they're healthcare professionals or not. And what we need to first do is stop that noise. We need to have the knowledge to transmit only factual information. So we need to stop forwarding all this nonsense book that is not based in fact. That's a starting point. The next starting point is to actually try to publish short articles about what people can do to prevent developing respiratory complications, simple breathing exercise, staying active, so that they actually don't get severe symptoms. And then those who are working in the clinic are ahead of the game. They are educated in terms of what they specifically need to do for their patients so that they're okay. So that's kind of how I would have this layered approach.
Okay. So, Dr. Ross, thank you for your informative sessions and taking
My
such a
pleasure.
pain at the late hours, probably around 2 a.m. I think so. Yes, sir.
Well, it's 3 a.m. now.
Thank you for your time and thank you for throwing us a insights, different perspective. So very thank you, sir, and thank you for the informative sessions. Okay. So now
Yes, I
we'll
just want to
move
point
on
out
to
that
the next session.
I just want to say thank you again. And if there are questions that you would like to direct to me, organizers, and I will try my best to respond to them.
Sure, sir. We'll take up the questions
Thank you
and
very
we'll
much.
try to make up a few other sessions in detail or other sessions, sir. Okay. So now
Pleasure.
we'll start with the second session of the day. I would honor to introduce our next speaker, Dr. Vishwanath Reddy, Associate Professor, College of Physiotherapy, SMS University, Tirupati, Andhra Pradesh. And his topic for the day is a role of physiotherapy in COVID-19. Dr. A. Vishwanath Reddy graduated from SRMC, Chennai in 1998. He has done his MPT in sports and from Wales College of Physiotherapy, Chennai in 2001. Sir has completed his PhD in SVMS University, Tirupati, and is working as associate professor in College of Physiotherapy, SVMS, Tirupati, Andhra Pradesh. It is honor to have you amongst us, sir. Over to Dr. Vishwanath Reddy. Sir, please. Over to Dr. Vishwanath Reddy.
Hello. Good morning,
Hello,
sir.
yes, sir.
So,
Good morning, sir.
good afternoon, everybody. So, first of all, I would like to thank the organizers of NIEPMD for giving me this opportunity to share a few
We cannot see
that is the
you,
points
sir.
regarding the physiotherapy role of physiotherapy in the COVID-19 patients. So, I'd like to start the session to the screen sharing.
Yes, sir.
Are you able to see the screen, sir? Please, anyone respond, please.
Sir, no, sir. Your screen is not visible, sir.
1 minute, 1 minute. Okay. 1 minute.
So you can choose the present now option, and then from there you can choose the
Now,
share screen.
now,
Yes, sir. Now it's
it's okay, sir.
yes, sir. Now I
Okay.
can see your presentations. Yes,
So,
sir. It's visible,
the,
sir.
my, my topic is today's topic is the role
Yes,
of
sir.
physiotherapy in
It's
managing
visible.
patients
You
with
can mention.
COVID-19. First, let me just start with the introduction. So, the COVID-19 is COV2, represents causative agent of a potentially fatal disease that is of global public health concern. This COVID-19 primarily targets the human respiratory system. The symptoms of COVID-19 infection appear after an incubation period of approximately 5.2 days. The most common symptoms are fever, cough, fatigue, sputum production, headache, diarrhea, dyspnea, and lymphopenia. In some cases, chest CT scan reveals multiple ground glass opacities in the subpleural regions of both lungs that likely and localized immune response that led to increased inflammation. Number of patients with respiratory syndrome caused by coronavirus is still increasing rapidly worldwide. 80% of cases that is a COVID-19 infection causes mild and moderate illness. Approximately 15% of cases develop severe illness leading to hospitalization, and 5% of the cases develop critical illness requiring intensive care unit treatment. Physical therapists have an important role in supporting hospitalized patients through respiratory support and active mobilization. Physical therapist management should be tailored to the individual patient's needs concerning the frequency, intensity, type, and timing of the interventions, in particular for those with severe or critical illness, older than 70 years of age, obesity, comorbidity, and other complications. And now let us discuss about the pathophysiology before we go on to the physiotherapy role. So, the coronavirus are enveloped positive sense single-stranded RNA viruses, which ranges from 26 to 32 kilobases. They infect a wide variety of host species. They are largely divided into four genera, that is alpha, beta, gamma, and delta, based on their genomic structures. Alpha and beta coronaviruses infect only mammals. The life cycle of the virus with the host consists of the following five steps: the attachment, penetration, biosynthesis, maturation, and release. So once viruses bind to host receptors, they enter host cells through endocytosis or membrane fusion, that is penetration. Once viral contents are released inside the host cells, viral RNA enters the nucleus for replication. Viral mRNA is used to make viral proteins, biosynthesis. Then new viral particles are made, that is maturation, and released. The coronaviruses consist of four structural proteins, namely the spike, yes, that is a membrane. You can see the image. You can see. The coronavirus consists of four structural proteins: the spike, envelope, membrane, and nucleocapsid. Angiotensin converting enzyme 2, ACE2, was identified as a functional receptor for SARS-CoV. Structural and functional analysis showed that the spike for SARS-CoV-2 also bound to ACE2. And generally, you can see that is an increased leukocyte counts in the patients, that that blood CRP levels are going to be above the normal range levels, and there will be elevation of the erythrocyte sedimentation rate. And patients admitted in ICU shows high levels of pro-inflammatory cytokines, including interleukins 2, interleukin 7, interleukins 10, that are reason to promote disease severity. Elderly people and those with underlying health conditions are considered to be more at risk of developing severe symptoms and have a higher risk of physical deconditioning during their hospital stay. The physical therapists have an important role in supporting hospitalized patients with COVID-19, but also need to be aware of challenges when treating these patients. Hospital-based physical therapists provide guidance and detailed recommendations for hospitalized patients with COVID-19. So now we can see in this slide the signs and symptoms. That the 83 to 99% of COVID-19 subjects, they'll have fever, and 59% to 82% they'll have this cough, and 44 to 70% subjects they'll have this fatigue, and 40 to 84% subjects will have weight loss, and 31 to 40% of subjects have the complaint of the shortness of breath, and 28 to 33% of subjects have the secretion production, and 11 to 35% of subjects have got this myalgias and mild symptoms up to mild pneumonia, and 80% that is severe, especially dyspnea, hypoxia, or more than 50% lung involvement on imaging, and 15% critical respiratory failure, shock, or multi-organ system dysfunction. The critical cases needing ICU treatment may show symptoms of ARDS, that is acute respiratory distress syndrome, such as lung disease with widespread inflammation in the lungs. Consolidation lesions also remain at long term and can leave fibrotic changes in the lungs. Furthermore, patients who are critically ill needing ICU treatment are at risk of developing post-intensive care syndrome, that is PICS, including ICU acquired weakness. 13 to 15% mortality among patients admitted in the ICU ranges from 39 to 72%. Recommendations contain specific physical therapy goals concerning respiratory problems and deconditioning, including ICU acquired weakness and PICS. The recommendations are outlined in two sections, that is section 1, patients who are critically ill with COVID-19 admitted to the ICU, and the section 2, patients who are severely ill with COVID-19 admitted to the COVID ward. And when it comes to the safety, that is recommendations of safety, the respiratory droplets and aerosols may be released from patients during physical therapist interventions and may cause further spread of the virus. Direct contact between physical therapists and patients with COVID-19 therefore should be minimized to avoid risk of virus transmission and reduce usage of scarce PPE. Okay, that is a personal protection equipment. Therefore, optimal use of telecommunication and written information material is essential while treating these subjects. If direct face-to-face contact with patients with COVID-19 is required, physical therapist should use PPE. Recommended PPE include a gown, gloves, eye protection, and a face mask. The treatment modalities which are leading to viral exposure. Certain treatment modalities can lead to extra viral exposure and can induce the release of droplets and aerosols. For example, you can see NIV, non-invasive assisted ventilation, or high-flow nasal oxygen therapy, and are the manual techniques for respiratory support, including compression, which may lead to coughing and secretion mobilization. Then the secretion mobilization devices such as positive expiratory pressure, flutter mucus clearance device, and a cappella DM and DH vibratory PEP therapy system, and high frequency chest wall oscillation devices, endotracheal suctioning, active mobilization, which may lead to coughing and secretion mobilization or disconnection of the mechanical ventilation. So all these, when we are using these treatment modalities, there is a risk of that is a viral exposure. And when it comes to the physiotherapy for COVID-19 subjects, the physical therapist management for patients hospitalized with COVID-19 comprises elements of respiratory support as well as active mobilization. Recommendations towards respiratory support defined as a proactive approach to minimize respiratory symptoms during the acute phase of a pulmonary disease. In the treatment of patients with COVID-19, respiratory support can consist of breathing control, thoracic expansion exercises, airway clearance techniques, and respiratory muscle strength training. So these four are very vital. I'll repeat again: breathing control, thoracic expansion exercise, airway clearance techniques, and respiratory muscle strength. Recommendations toward active mobilization concern the proactive approach to support any physical activity where patients assist with the activity using their own strength and control. Examples of active mobilization are bed mobility activities, example bridging, rolling, lying to sitting, and active range of motion exercise, active assisted limb exercise, and activities of daily living training, transfer training, cycle ergometer, free gait exercises, and ambulation. And here, that is the first thing is in section 1, we are going to talk about the patient who is critically ill and is admitted to ICU. The recommendations for physical therapy during mechanical ventilation in the ICU depend on the level of consciousness and cooperation of the patient. Therefore, the recommendations for physical therapist management differ between phase A, where the patient is unconscious, and phase B, where the patient is conscious and able to cooperate. That is in phase A, where the patient is unconscious, so mainly we have to give respiratory support. Patients with critical illness due to COVID-19 may develop ARDS-like symptoms. Initially, the majority of patients are deeply sedated and mechanically ventilated in prone position. These patients often receive neuromuscular blocking agents to support mechanical ventilation, as this drug application can improve chest wall compliance, eliminate ventilator dyssynchrony, and reduce intra-abdominal pressures. Given the lack of therapeutic goals in this phase, the physical therapist management concerning respiratory support is not recommended. This might be different for physical therapists with other scope of practice concerning respiratory support. And when the patient is unconscious, the patients who are deeply sedated cannot actively participate in mobilization. Physical therapist management in this phase focuses on maintaining joint mobility and preventing soft tissue contractures. The administering of neuromuscular blocking agents, however, reduces the risk of contractures. Additionally, the evidence base for preventive stretching is limited. When neuromuscular blocking agents are discontinued, the risk for developing contractures increases. If contractures are suspected, nurses can consult physical therapists for advice on passive movements, limb positioning, or splinting. And when it comes to the phase B, that is the patient is conscious and able to cooperate. So here what we are going to do. The moment sedation is reduced and the patient is conscious and able to cooperate, so here this is the phase to start active mobilization and respiratory support. However, in patients with COVID-19, detachment of the closed mechanical ventilation system circuit should always be avoided due to the risk of virus transmission. Even in the case of weaning from mechanical ventilation, the risk of virus transmission via droplets or aerosols in using medical assisted testing devices is too high. In case of prolonged weaning, patients who fail more than 3 weaning attempts or require more than 7 days of weaning after the first spontaneous breathing trial, respiratory muscle training should be discussed in the multidisciplinary team. In the phase after prolonged assisted mechanical ventilation, the inspiratory muscle training and expiratory muscle training can be used to counterbalance the weakness of the respiratory muscles. Additional benefits of strengthening are increased exercise tolerance and cough strength. Usually, non-invasive handheld manometers, manometers to assess maximal static inspiratory pressure can help quantify respiratory muscle strength and initiate training. So when it comes to the phase B, that is the patient is conscious and able to cooperate. That is what is the role of active mobilization. When patients become conscious and cooperative, active mobilization can be considered. Active mobilization should aim to prevent ICU acquired weakness and deconditioning from immobilization and illness. The Medical Research Council sum score is widely used to diagnose ICU acquired weakness, which is defined as a Medical Research Council sum score, which should be less than 48. It is assumed that patients diagnosed with ICU acquired weakness may benefit from active mobilization also following their ICU admission. Close monitoring of respiratory and hemodynamic functions of patients is crucial to ensure patient safety. As a first step, bed mobility activities can be performed by assisted bridging, rolling, and transferring from supine to sitting. Medical assistive devices, example a bed cycle, might be used to support active mobilization. However, use of these devices should be discussed with hospital officers for attention. The suggestions for active mobilization sessions in patients with COVID-19 at the ICU. So here in the step 1, so we can use the bed mobility activities like bridging and rolling and assisted exercise while lying supine, that is the cervical rotation, shoulder elevation, biceps flexion, finger flexion and extension, ankle pumps. So all these starting with 5 repetitions in one set with progression to 10 to 15 repetitions in the 3 sets. And in the step 2, we can do that is active mobilization in supine should be well tolerated and patient safety criteria should be met throughout the entire session. Generally here, the bed mobility activities, assisted exercise with sitting, then along with that we are going to add up passive or active bed cycling for 20 minutes. So this is also going to be helpful. Next. The section 2, that is when the patient is severely ill and admitted to the COVID ward. Okay. So what is the role of physiotherapy? So here patients who are severely ill with COVID-19 who require hospitalization can present with complications such as pneumonia, hypoxemic respiratory failure or acute respiratory distress syndrome, sepsis and septic shock, cardiomyopathy and arrhythmia, acute kidney injury, and complications from prolonged hospitalization, including secondary bacterial infections. Because the consequences of the infection impact the respiratory system, one of the goals of physical therapist management is to optimize respiratory function. Therefore, respiratory support aims to improve breathing control, thoracic expansion, and mobilization and evacuation of secretions. Active mobilization aims to increase or maintain physical functioning and independence in ADL. These recommendations also apply for patients recovering from critical illness due to COVID-19. Additionally, in patients recovering from critical illness, respiratory muscle strength or endurance training can be continued. And the role of respiratory support. Respiratory support serves several purposes, that is to improve vital capacity, to evacuate secretions, and to strengthen respiratory muscles. So let us discuss the techniques and goals are briefly introduced as follows. That is improvement of vital capacity, that is to relax the airways and relieve the symptoms of wheezing and tightness that normally occur after coughing or breathlessness. That is respiratory frequency greater than 25 breaths per minute and modified Borg dyspnea scale more than 4 and breathing control is used. Breathing control can help if patients with COVID-19 are experiencing shortness of breath, fear or anxiety or in a panic. It stimulates tidal volume breathing with neck and shoulders relaxed from contracting for inspiration. Patients should be encouraged to breathe in through their nose to humidify, warm, and filter the air through the inspired flow. The length of time spent performing breathing control may vary depending on how breathless patients feel. Difficulty of breathing can be evaluated using the modified Box dyspnea scale. Thoracic expansion exercises are recommended to improve ventilation also in the lower lung fields. This increases the vital capacity and improves lung function, especially if atelectasis is present. Patients should be stimulated to inhale deeply and slowly, combined with chest expansion and shoulder expansion. And we can just see some of the pictures like there's a in breathing exercise that the deep diaphragmatic breathing exercise is going to be helpful lot. Okay, so as we know that is while taking breathing in, okay, so there should be abdomen should come out, and during breathing out the abdomen should go in. Okay, so and okay, that is a pursed lip breathing technique. That is a breathing via nose and breathe via mouth. And thoracic expansion exercise. So in that is the patient should be seated in a chair comfortably, and that while when the patient is breathing in, he has to take hands up and do the breathe in, and bring the hands down while breathing out. So which is going to aid in the thoracic expansion. And this is another technique called as a Beautico breathing technique, where so that is a he has for breathing out and breath hold, and he has to hold, then he has to do the that is a breathe in. Okay, so this is a Beautico breathing technique. And for evacuation of secretions, this is also very important. Early reports indicate that patients with COVID-19 do not show airway mucus hypersecretion. However, patients with specific comorbidities like COPD, cystic fibrosis might actually need respiratory support due to airway secretion retention or ineffective cough. In case of clinical signs for presence of airway secretion, so different techniques and devices can be applied to mobilization or evacuation. When using these techniques, the safety recommendations have to be followed. The active cycle of breathing techniques, that is ACBT, are the preferred procedure. Huffing and coughing contribute to the formation of respiratory droplets and aerosols and should be avoided in direct contact with healthcare professionals. Therefore, these maneuvers are only recommended in case of airway obstruction due to excess secretions. The multidisciplinary team should carefully evaluate whether airway obstruction is present through medical history taking, that is example the presence of productive cough, the physical examination, that is the example the presence of pulmonary rhonchus and observations. After transfer to the COVID ward, the respiratory muscle strengthening can be continued for patients recovering from critical illness according to the recommendations which are discussed in the section 1 phase B. The training protocols typically use resistive loads ranging between 30% and 80% of maximal static inspiratory pressure. However, the use of non-invasive hand recommended in patients hospitalized with COVID-19 due to increased risk of virus transmission. One of the unique advantages of respiratory muscle training is that it can be implemented in shorter intervals, that is 30 breaths 2 times. Respiratory muscle training have been observed for multiple protocols lasting only 4 weeks. A telehealth or mobile app-based model would allow for the opportunity for real-time remote monitoring of compliance and assessment. Telehealth and home-based models for respiratory muscle training have been studied with similar effects. And use breathing control and thoracic expansion exercise to improve the vital capacity. Use active cycle of breathing techniques in patients who need airway clearance to stimulate secretion, mobilization, and evacuation. Use inspiratory and respiratory muscle training in patients recovering from critical illness with suspected respiratory muscle weakness. If patients are bedridden and suffering with COVID-19, pulmonary ventilation can be stimulated by bed mobility activities to bridging, rolling, and sitting. A vertical position can be obtained with less support of patients by tilting the bed or using a tilt table. And the discharge recommendations. The hospital-based physical therapy should screen patients with severe illness due to COVID-19 on whether physical therapy should be continued after hospital discharge. Patients may experience loss of function and independence due to hospitalization and in severe cases develop a PICS, including physical, cognitive, and mental impairments as a result of their prolonged stay in the ICU. Based on the earlier experiences and knowledge, substantial increases can be expected in long-term healthcare need for patients with COVID-19. Continuing care based on patients' needs after hospital discharge is important. The hospital-based physical therapist has an important role in guaranteeing continuity of physical therapist management. When hospital discharge is forthcoming, sufficient handover of patient information to physical therapist is needed. Based on clinical expertise with post-ICU rehabilitation, it is recommended that discharge information should at least contain anamnestic information, that is medical, psychosocial, uh, patient's clinical question, goals and provided physical therapy and recovery process, current limitations in functioning and daily life activities, and other involved healthcare professionals. And last one is the psychosocial support. The COVID-19 outbreak presents new challenges for healthcare professionals. The physical therapist will work intensively with patients who are severely ill, which can lead to mental health distress. It is recommended for managers to plan sufficient recovery time between work shifts of physical therapists and to let less experienced colleagues carefully be supervised by experienced peers. In these turbulent times, provision of psychosocial support should be considered. It is important that recommendations will be provided for the multidisciplinary care after hospital discharge, given the physical, cognitive, and mental impairments of patients with COVID-19. In addition, COVID-19 is a novel disease, and our understanding of the symptomatology, clinical course, recovery, and transmissibility is emerging. Thus, treatment paradigms need to be evaluated and updated as new information becomes available. So, so thank you very much for giving me this opportunity. If you have any doubts, any questions, I can answer.
Hello.
Hello.
Sir, I'm Panika here.
Good afternoon, ma'am.
Good afternoon, sir. Sir, what is the physiotherapy recommended for old age people who are above 60 years?
Hello, madam.
Sir,
Physiotherapy
what
for
is the recommended physiotherapy for people above 60 years, sir, at home? For my
at home.
parents. Yes.
Okay. So actually, so we have to see for any comorbidities, madam. We have to take care. Suppose if they're diabetic, hypertensive, so we
Okay.
should first check the so whether they are regularly using those medications for those comorbidities, and mainly, so our aim should be they should do that is a breathing exercise, which is very important. So as we already mentioned, we can use that deep diaphragmatic breathing exercise, a thoracic expansion exercise, okay, which are going to help a lot. And they have to do minimal mobilization. At least they should just do some ambulation is very important. They should do minimal walking at home, so which is going to help a lot. Okay.
Okay, sir. Thank you, sir. Thank you.
Thank you.
Thanks, sir.
Thank you. So if there are no questions, shall we conclude? And I thank the organizers again, once again, the of NIPMED for giving me this opportunity. Thank you very much.
Thank you, sir.
Thank you, sir.
Thank you for
Thank,
your neatly
thank,
detailing out the rehabilitation process from the acute setup process from ICU rehabilitation to the rehabilitation of patients in the wards. It was a quite informative session, and thank you for
thank,
enlightening with your resource, sir. Thank you, sir. Thank you for the session. So next we'll start with our next session. So this will be the final session of today now. This is a critical session before lunch, and I would like to welcome Dr. Sudhakar, Professor Research Aide, College of Physiotherapy, Kripanati College, Bengaluru, and his topic for the day is role of rehabilitation for patients, challenges following COVID-19. Dr. Sudhakar is a research head and the professor in Kripanati College, former principal from Meenakshi Academy of Higher Education and Research, and is the first PhD output in Tamil Nadu, completed PhD in March 2012. And he also worked as a research supervisor, completed guidance for 4 PhD scholars in Wales University, Chennai. And he's also a consultant sports physiotherapist for athletes participated in Asian Pacific Games event held in Malaysia, September 2018. And also appointed as a first physiotherapist for Tamil Nadu State under 22 cricket team TNCA from 2006 to 2008. And he also has a chief physiotherapist, sports physiotherapist for Commonwealth Games Junior Fencing Championship, January 2006, international event held in Chennai, organized by 12 countries. And he has merits of more than 42 publications, out of which 40 from Scopus Index journals and the 2 PubMed Index publications. And he also organized many workshops on functional diagnosis on upper limb, upper sacroiliac and lower body dysfunctions in Chennai and Bangalore, Hyderabad, Pune, and Rajahmundry. And as far as a clinical practitioner, he devised a predictive model and a comprehensive musculoskeletal screening for patients troubled with postural and musculoskeletal dysfunction. Now I kindly request Sudhakar sir to start over session. Over to you, sir.
Okay. So is my voice clear?
Yes, sir. Your voice is clear.
Yeah. So thanks for the wonderful introduction, and thanks to NIEPMD Organizing Secretary Dr. Santosh Khanna and the official director Srinivas K. Rao, and for inviting this webinar. So it is an excellent discussion and presentation by the last 2 speakers, Dr. Joseph and Dr. Vishnath Reddy. So we'll go to the presentation because already I think we are a little bit running out of time. Shall we go to the presentation? Yeah. Are you able to see the slide?
Sir, still we are waiting for that.
Are you able to see the slide?
Nope, sir.
No.
Sir, after choosing the person now and
Okay.
yeah, clear. Nice and clear.
The topic is physiotherapy rehabilitation for challenges following COVID-19. So I'm going to discuss about only the challenges. Okay, challenges mainly by the medical team, and it is like a complete rehabilitation, everyone, and how they are facing these challenges, how we are trying to bring out the patient as much as early as possible to their functional level, and as much as possible to discharge the patient from the critical illness. So COVID-19 and challenges. So what did we learn from this pandemic? Okay, so leave all the subjects. Okay, so leave all the subjects, physiotherapy subjects, everything. First, we have to know how to be. We have to learn the humanity and morality. So what did we learn from this pandemic? Okay, so did we evolve as a humanity or devolve? So we have seen many disasters. Okay, so Chennai flood 2015, and so many disasters. The world has seen. But this is also it is a disaster, and how we are going to take this as a challenge, and we are going to come out of this. So did our actions raise our morality? Okay, so as a physiotherapist, you have to always maintain ethics and morality, or did our morality influence our actions through this crisis? Have we imparted a positive impact on ourselves and each other? Okay, so because the main challenge is what?
physiotherapists and as well as the healthcare workers, they initially in the month of March, April, May, okay, so working with the COVID patient has become, it was a big challenge. Okay, so we saw many videos in WhatsApp, like Apollo Hospital doctors, they posted on video, encouraging the interns and house agents, students to come and work on the work with the COVID-19 patients. So the positive impact on ourselves is much important first, and then how we impact with each other. Okay, so with the medical team, with the patients, so that's all important. And what we have learned from this COVID-19, the new historic divide. Okay, so COVID-19 pandemic ravaged the globe. We saw a world connected through globalization. Okay, so everyone was talking before this pandemic issue, the globalization, the global what to say, the trade, which is boosted up to several crores, several $1 million, where American companies investing in Chennai. Okay, so there is a lot of globalization going on. So, but divided in response and disproportionately implicated by it, is the pandemic driving the world to close off and become more homogeneous, right? So we are all now homogeneous. Whatever Chennai is now maintaining the social distance, and then the government instructions is followed same in another European countries and as well as throughout the globe. So we, even though we are all divided, but we are now becoming homogeneous. So changes in life. The COVID-19 pandemic has been a global wide event. It has fundamentally changed the way of human to go about their lives. Okay, so how we have changed our lifestyles now. Okay, so the mall is closed, the parks are closed, the theaters are closed. So how the lifestyle has changed now. So from education to work, the schools are closed, colleges are closed, everything's online. To healthcare and safety. Okay, so even the doctors are conducting online consultations. Okay, so even physiotherapists are conducting online consultations. So all the familiar systems and processes have been replaced with new unfamiliar ones. Okay, so that is a big change in the world, big change in the environment. Okay, so we have to cope up with this. So that is the big challenge. We have to cope up with this. First, we have to train ourselves. Okay, so we have to train ourselves. How a patient will come to you when you don't give them a confidence, and when you have a fear, how a patient will come to you. So we have to change. We have to get adapt to the unfamiliar ones. The COVID-19 infection, coming to the COVID-19 infection, the perspective is on immune response. So everyone, what they say, okay, so if you have a poor immunity, you will catch up a fever. If you don't have a good immunity, you will have cold. Okay, this is quite common. Everyone knows this. Okay, so everybody, even the school-going student, knows to how to boost up the immunity. But the main problem in the COVID-19 is the perspectives on immune responses. I will tell you what is the big challenge in this immune response. So scientists and clinicians have learned much of coronavirus disease from 2019 COVID-19 and its pathogenesis. As like the doctor Joseph, okay, Dr. Joseph, how people throughout the world, they're continuously doing research, okay, molecular biology, microbiology, they're doing on the pharmacology. So they're doing continuous research and trying to help the COVID-19 patients. They're trying to find out what is the, how the pathology changes and how we can stop the incubation period. Okay, lots of research going on throughout the world. So what is the biggest challenge? Not all people exposed to SARS-CoV-2 are infected, right? You all agree with this. Okay, so some of them are very mild or pre-symptomatic, and not all infected patients develop severe respiratory illness. Okay, so that is also a biggest question mark. So for the first thing is what, not all people exposed. Okay, so we are daily seeing milkman coming to our home. Okay, so servant coming to our home. They're exposed to many things. They're coming continuously from the month of March, February, May, every month they're coming and they're exposed to coronavirus, or they're exposed to risk, but they are not infected. And not all infected patients develop severe respiratory illness. Now this is the we say asymptomatic active carriers. Okay, so they are not developing severe respiratory illness. So what is the challenge? The same. Okay, I repeat, not all people exposed to SARS-CoV-2 are infected, and not all infected patients develop severe respiratory illness. Then who is the one odd man out who is coronavirus and developing a severe respiratory illness? Okay, that is what I'm going to discuss now. So once if you want, at the end of the presentation, you'll be able to reason out, okay, oh, these are the reasons that this person has got infected with COVID-2 and this person is admitted in ICU. Okay, so these may be the possible reasons. So older versus younger, you all know older immune systems tend to be less efficient at clearing viral infections. So severe COVID-19 is driven not just by viral damage to the cells, but by a reactive storm of inflammation that harms the lungs. Okay, so it is not just a viral fever or not just a cold. It is a reactive storm of inflammation which harms the lungs and other organs. So that is the severe COVID-19. Okay, so leave about the mild and moderate. That is all cold, fever, fatigue, body pain. Okay, so that is all mild. But what is the main problem with the COVID-2 virus? It is the storm, okay, which is hitting the lungs. Men as women. So as per the data, as per the research today's date, the men are mostly affected when compared to women. The reason is like men drink alcohol, tobacco, smoking, so which weakens their immune system and increases susceptibility to pneumonia. Always men has lots of predisposing factors to develop pneumonia. So that may be one of the reasons where men is mostly affected than the women. So what are the underlying medical conditions? You all know, okay, the previous speakers also spoke about this. 1 out of 3 in American population will be are infected with because of the diabetes. Okay, so and compared to our countries, the European and American countries are in high risk. So diabetes and obesity are associated with weaker resistance to infections. Asthma and COPD. Okay, so involves reduced lung function and a greater susceptibility to lung inflammation. Okay, so only these people who have a comorbidity are at high risk of getting exposed to COVID-2 and getting the infection. So moreover, patients with these disorders often use what corticosteroids, immune suppressing medicines. So which reduce immunity to respiratory infections. Okay, so they are more prone for respiratory infections because they're taking corticosteroid immune suppressing drugs, and that is the underlying medical condition which patients develop COVID-2 and becoming severe. So some researchers have suggested that common treatments for high blood pressure and diabetes, okay, may worsen COVID-19 risk. So it was already discussed by the previous speaker, and the moderator also raised a doubt on acetylcholine enzyme inhibitor, which may be the reason for the risk. And yes, that is the level. Okay, so this acetylcholine which enters into the cell, and these drugs can boost the levels of ACE2, a cell surface enzyme that the COVID-19 coronavirus used to get into the cells. Okay, so the coronavirus easily enters into these cells. So these cells are present outside the lungs. Okay, it is present outside the lungs, and the virus easily affects the ACE2 inhibitor. So, however, there is no clinical evidence. Okay, so don't take this slide as a message that BP patients and active patients should not take medicine. Okay, so it is still on research. So there is no worsened risk, and doctors generally have not advised patients. Okay, don't take that. Don't say that it says speech and then BP patients and diabetes patients should not take medicine. It is not like that. But there is a risk. Okay, so that is what we are saying. Okay, so comorbidity. Okay, so these patients are at risk for developing the virus. Maybe because of the medicines, but doctors have to do a lot of research on that. So many people take non-steroidal anti-inflammatory drugs. Okay, so this we can advise our patients. Okay, so most of the patients who come for physiotherapy, for the pain, what they take NSAIDs, such as ibuprofen, like arthritis. So from now onwards, you can educate your patients, to stop NSAID because this is related to COVID-19. Okay, so this is related to virus. Okay, so these drugs stress the kidneys, and when taken long term, may even cause chronic kidney disease. You all know this. That is potentially a problem in the context of COVID-19 because the infection often attacks the kidneys. So this COVID-19 infection affects the kidneys, and if suppose a patient is regularly they take NSAID, they go to the pharmacy, they take self-medication, and they are at high risk of developing the disease. So it is proved some intensive care specialists have observed unexpectedly severe cases of COVID-19 in people with histories of long-term NSAID use. Okay, so it is proved. So you can educate your patients to control the intake of these medicines. And the next problem is immune system gaps. Okay, so what is a gap here? So some people who seem perfectly healthy and are not considered immune deficient. Okay, so your friends, your relatives, you may be seeing him. He's a gym athlete. Okay, he's a very good body build, but there is a chance for him also to develop virus. Okay, so there is an immune system gap. So people who are perfectly healthy also are vulnerable to certain viral infections. Okay, So this may be due to random genetic variation. The problem is because of the genetic variations. Again, there is a big research going on. I'll show you that. I'll explain you that. So this may be due to random genetic variation as well as ethnic background. In principle, populations with less historical exposure to coronaviruses would be more vulnerable to COVID-19. Okay, what do you got from this? So people who are less historical exposure. See, as I told you before, milkman coming to our home daily, and the vegetable vendor are coming. So people who are all exposed already. Okay, so their body immune system will be good. Okay, so people who have a less historical exposure to coronaviruses could be more vulnerable to COVID-19. So this is a problem. Like, okay, I have seen some of my neighbors who are all locked inside the home for last 4 months, 5 months. Okay, then they have not stepped down out of their house. Okay, so because of the coronavirus, and one day if they come out, they catch the virus. Okay, so what we have to do, we have to slowly expose our body immune system, and that is why we say, commonly from our childhood, if you get fever, your body immune system is improved. Okay, so we have to expose a little bit, but at the same time, you have to be careful. You have to wear mask. You should not touch your face, nose. Okay, so whatever the government says and the doctor's advice, you have to follow. But the immune system gap is one of the biggest challenge in the coronavirus 19 COVID-19. So viral dose, as I told you already. So doctors have long known that amount of dose of exposure to an infectious agent can be an important determinant of disease of severity. The researchers are now looking at this as a factor that possibly explains why healthy people are hit so hard by COVID-19. Okay, so this is a big challenge. Why healthy people are hit so hard by COVID-19? Because of the exposure to the infectious agent. So catching a low dose from someone who was mildly symptomatic on the subway may involve a lower risk of severe illness. You all know this, compared to catching a high dose from a very sick and highly contagious patient. So try to be very careful with a highly contagious patient or very sick patient. So unknowns, what are the things still remain unknowns? Ultimately, researchers will need time to analyze the coronavirus that causes COVID-19 and evaluate the characteristic of patients who become infected in order to tease out the complex factors that explain why some people get mortally sick while others get only a brief fever and cough or no symptoms at all. Okay, so for some people, even over the age of 50 plus, I've seen some people who catch cold and then who got cold, cough, but they didn't test anything and they didn't go for the COVID test, but it just gone in 1 or 2 days. Okay, so there are lots of unknown reasons out there. So while we wish we had all the answers, we clearly don't yet. Still research is going on in these areas. Again, viral strain. Okay, so we saw so many news and then got in WhatsApp. There are so many viral strains are there in COVID-19. 8 strains are there. The strain which has come to our Chennai is very less virulent. Okay, there is all wrong information. So SARS-CoV-2, which caused COVID-19, is a single-stranded RNA virus that has the ability to mutate quickly. The one thing, what good positive news is now is like the mutation has come down. Okay, that is what generally the doctors are giving the news now. So the mutation, the replication of the RNA virus has come down. So what happens now? The number of days being sick is reduced now. So that is one good positive news now. But over time, as it spreads around the world, it develops genetically distinct strains. Okay, so it has developed distinct strains, but some of these strains may spread more easily or cause more severe disease. And however, today there is no evidence that SARS-CoV-2 virus circulating now are clinically very different from each other, or that their minor genetic differences explain the range of the patients that they are experiencing. So we have 3 stages of COVID-2. Stage 1 is asymptomatic incubation period, okay, with or without detectable virus. So what is that asymptomatic incubation period? A person who has got fever on, okay, so 11/9/2020, a person has got a fever onset today. So 2 to 14 days before 11th, okay, maybe from August 31st to 11th or August 30th to September 11th. So that is the incubation period where that person has been exposed to the virus. Okay, so and that is the incubation period. So what is the biggest problem in this? The person who is in the incubation period doesn't know he is having a virus. So with or without detectable virus, they may have a chance to spread the virus. Did a lockdown for this 3 months. Okay, so the second stage is what? Non-severe symptomatic period with the presence of virus. The virus is there, fever is there, but non-severe. Okay, it is a symptomatic period. Okay, does it non-severe? The only mild fever is there, 99, 99.4, only mild fever was there. So what is the stage 3? Severe respiratory symptomatic stage with high viral load. Okay, as a famous playback singer SP Balasubramanian, no? So who got this severe respiratory symptomatic stage. So these are the 3 different stages of the coronavirus. So what is unanswered? One of the biggest unanswered questions. What is the challenge here is why some develop severe disease while others do not. The same point. So clearly the conventional wisdom based on all our overall immunity of the infected patients cannot explain this broad spectrum in disease presentation. Still it is unanswered. So the two-phase immune response induced by COVID-19 infection is, it is two-phased. The first phase is called incubation and non-severe stage, and the second stage is severe stage. So during the incubation and non-severe stage, okay, as I told you, what is the incubation period? 2 to 14 days. So maybe with or without detectable virus, and the non-severe symptomatic stage, there is a specific adaptive immune response is required to eliminate the virus. Okay, so we have to educate our patients. We have to educate the persons who are all, they may be. If you go to the Kerala now, we are quarantined. Okay, if you go to Karnataka, you are quarantined. What is the reason? There may be a chance, okay, you may be having a virus. Okay, there may be a chance that the virus is detected in you. So that is the reason this stage a specific adaptive immune response is required. And why it is required? To eliminate the virus and to preclude the disease progression into severe states. So what is the biggest role here? What is the biggest challenge here? The person who are having a mild symptom, they should not go to a severe states. So what is the important thing here? We have to improve our immunity response. So powerful way to restore your immunity during the incubation and non-severe stage. There are many strategies to immune response. Okay, the anti-serum and pegylated proteins are the very important proteins at this stage, and there are lots of strategies to boost immune response. And for the development of an endogenous protective immune response at the incubation non-severe stage, we have to be in a very good general health, and the appropriate genetic background is also important here, and that elicits the specific antiviral immunity. Okay, there is one more area where I will talk about the genetic background. Okay, so even if you are very good, that's what I told you, even a good healthy person becoming sick, okay, be developing into a severe stage. The reason is because of the genes, because of the genetic background. So eating and drinking the right foods are a huge contributor to a healthy immune system. So what we eat deeply impacts our immune system. The whole plant food nutrition. So, okay, take as much as plenty of fruits, vegetables. Okay, so that create health in the body. And processed foods, meat has to be avoided. That creates more toxic load on the body. And whether you turn to a strict vegetarian diet is a personal choice. I'm a strict pure vegetarian, but I'm not advising that everyone should turn vegetarian diet. If you feel that you are in an incubation period, or if you have a mild processed food or meat in that stage, okay, so try to take as much as vegetable fruits, and try to take as much as vegetarian food during that time. So the next important problem is stress is a very powerful player in your overall immunity. I got this information from one of my cousin sister. She is the vice chairman of Rela Institute. Okay, she is Dr. Gomati. She is the vice chairman of Rela Institute, and she's one of the leading liver transplantation surgeon in Asia. Okay, she has conducted many surgeries in Pakistan. She has gone to Pakistan and done surgery there. So such a great credit she has got. What information I got now is the healthcare workers, the nurse people, the physiotherapists community, the doctors. So everybody are in tremendous stress because of continuously last 6 months they're treating COVID-19 patients. Okay, so stress is like, you just think about their stress. Okay, wearing the PPE kit itself is a big stress. It's a big challenge. Okay, so wearing the PPE kit, and the nurse people wearing that dress and coming and taking the blood from your vein is a big challenge, because the continuous fog will be there. Okay, so of their sweat, and then fog is there, their vision is not clear. So just think about their stress. Okay, so if you are following the news every minute of every day around this COVID-19, now I think the COVID-19 news is the 10th news now. But last 3 months now, back it was always whatever news channel you switch it on, you get about the COVID-19, about the death, about the lots of information in the channel. And Initially, we got lots of forward messages, in WhatsApp, in Facebook, only about this COVID-19. So if you follow the news every minute of every day, okay, so there's a big problem. Try to understand this. Don't neglect this. There are many people suffering this. They develop anxiety disorder. Okay, even the what do you say? Your children. Okay, so your school-going children, and even the college students. There are lots of these people during this COVID-19, this lockdown period, and this last 6 months. The problem is because of the induced stress. So developing fear and feeding those fears only bring you down. Okay, so nothing will happen. Even if you go COVID-19, you'll be coming out of it. Okay, so nothing will happen. So don't have any fear. So here's what happens when you have fear and anxiety in your thoughts. Your body releases cortisol and adrenaline, which are pro-inflammatory and can exacerbate any chronic condition you may already have. Okay, so even if you are having a mild virus which is not detectable, if you have a stress, that will boost up the virus. So it can also lead to illness as the body is working to fight a perceived enemy, even if that stress is simply something you are watching on the television. Okay, so if you're watching something on the television which is not a negative news, okay, don't watch that. Okay, so turn off. The stress response can work against you. So you can turn it on when you don't really need it, and as a result, perceive something as an emergency which is really not required. You can turn on when you are just thinking about past or future events. Okay, so people who get COVID positive. Okay, so what is happening is I had lots of interaction with COVID-19 positive patients. They say like they are thinking about their past events. Okay, their karma. Okay, so they did lots of bad sins. That's why they got this. Okay, it's all foolish rubbishness. They think all the negative thoughts and negative emotions develop, and about their future events. Okay, future events, how whether I will live after 3 days, whether I will be living tomorrow, okay, whether I will exist tomorrow, tonight something may happen to me. Okay, there are lots of negative thoughts and stress going on in their mind. So harmless chronic conditions can be intensified by the stress response activating too often with too much intensity or too long. Okay, so you can see this COVID-19 you can control. So it might be helpful to use a sheet of paper and draw a line down the middle. I can't control. And the other column you can write things I can control. Okay, you can't control how the virus spreads around you, right? You can't control how the virus spreading around you. But what you can control your prevention measures. Okay, so that is important. So limit exposure to social media and unwanted news. So here are some great proven strategies for unrailing stress in your life. Take a walk. Okay, more on this in a minute. Take a walk. Leave the room if you're stressed. So connect to your breath. Do breathing exercise. Connect to your breath. So feel your breath. Feel your breathing pattern. Notice how you're breathing. Create a slow, steady rhythm. And meditation or prayers. Okay, Sadhguru meditations are there. You can follow any of the meditation as you like.